Welcome to another educational video from NCRM. I'm Dr. Scott Whitten, and I'm from the Nevada Center for Reproductive Medicine. And I was going to talk to you today about something a little bit different than what we previously talked about in our other videos, which has been primarily treatment-based. And this time I'd like to talk to you a little bit about how do you optimize the chances of getting pregnant in natural cycles? So giving you a good chance of getting pregnant and not having to come see a fertility specialist. So the first thing you have to know is the female partner's cycles regular or not? Because if her cycles are not regular, then she's not ovulating consistently, and therefore there's not really a good chance of getting pregnant. But those women that are ovulating and they have a nice regular menstrual cycle every month, then you can actually monitor those cycles yourselves to try to time when's the best time to have intercourse. Most commonly, we would use something that you can buy over the counter. You can get them at Walgreens, Walmart, Target, wherever you want. It's a kit that's called an ovulation predictor kit. And the brand that we would recommend is Clear Blue Easy. There's a lot of different brands. You can even get them at the dollar store. I wouldn't recommend doing that one. But get a decent kit. And what you're going to be using that kit for is to try to determine when you're going to be ovulating so that you can time your intercourse appropriately. So when you use those kits, what you're detecting is actually a signal that's coming from the brain to the ovary called the LH surge. And the LH surge can be detected in the urine. So that means if a woman is checking her urine each day with these kits, she can go from a negative, and then a positive. That positive is telling her that she's going to be ovulating. She hasn't ovulated yet, but she's going to be ovulating. So that is your best indicator as to when to have intercourse. We would recommend that you have intercourse that day and the following day, because it's critically important to have sperm present up in the fallopian tubes before the egg is released. Because once you have an egg that is released from the ovary, that's called ovulation, that's the actual release. There's a limited amount of time to be able to fertilize that egg. It's actually only about 12 to 24 hours, so the time is obviously very important. But sperm that are present in the genital tract can live there for a while, so you're better off having sperm present earlier rather than late. Because say if she ovulated and then you had intercourse the following day, the chance of you getting pregnant is pretty darn low unless you had intercourse earlier on. So that's one good way of going ahead and timing when to have intercourse each month in a woman who's cycling regularly. If she's not having cycles regularly, like she has a period every 8 weeks or every 3 months, that is not normal. You should seek help with your obstetrics and gynecologist or come see a fertility specialist to determine why is she not ovulating correctly, and then discuss what treatments are available to help her ovulate consistently, because that's going to be critical. So I hope you enjoyed this point today. Look forward to seeing you in another video. Have a good night.